Did you know that nearly half of all adults in the US, about 120 million people, are living with high blood pressure? That's according to the Centers for Disease Control and Prevention. It's a chronic condition that usually doesn't cause any symptoms, but it quietly damages your blood vessels and organs, raising your risk of heart disease and stroke. Because of how serious it can be, doctors often prescribe medication when your blood pressure gets too high. But here's the good news. Some foods might actually help bring it down, and if they work for you, you might not have to rely so heavily on medication. In this video, we're going to take a closer look at a food you probably already know: bananas. We'll explore how eating just 2 bananas a day might help lower your blood pressure. We'll also cover other surprising health benefits of bananas you might not know about. Still, too much of a good thing can be bad for you. And we'll go over some cases where eating bananas could be a bad idea. Before we dive into how bananas might help lower blood pressure, let's take a quick look at what 2 bananas actually give you. They're packed with essential minerals, plus a good dose of fiber and healthy carbs your body can actually use. 2 bananas provide about 54 grams of carbs, including around 6 grams of fiber and 28 grams of natural sugar, the kind your body knows how to handle. They're also rich in nutrients like potassium, vitamin B6, vitamin C, and magnesium. In fact, just 2 medium bananas can give you roughly 840 to 900 milligrams of potassium, nearly half your daily vitamin B6, and around 22% of your daily vitamin C. So how do bananas help lower blood pressure? Bananas aren't just tasty, they're actually great for your heart. That's because they're loaded with potassium, a mineral well known for its role in lowering blood pressure. Here's how it works. According to the American Heart Association, potassium helps your body get rid of excess sodium through urine. And why does that matter? Because too much sodium causes your body to hold on to water. That extra water increases your blood volume, and more volume means more pressure on your heart and blood vessels. That's what pushes your blood pressure higher. But when you eat potassium-rich foods like bananas, your kidneys are better able to flush out that extra sodium, and that helps bring your blood pressure down naturally. That's the first way potassium helps. The second, it relaxes and widens your blood vessels, a process known as vasodilation. When your blood vessels are more open, blood can flow more easily. That takes some of the pressure off your heart, so it doesn't have to work as hard. And that also helps lower your blood pressure. In fact, studies published in journals like Current Hypertension Reports show that potassium helps the muscles in your blood vessel walls stay flexible and relaxed, which supports smoother blood flow. And bananas, they're one of the easiest ways to get more potassium into your diet. A medium banana has around 400 to 450 milligrams of potassium. That's about 10% of your daily recommended amount. If you're looking for a simple way to take care of your heart, adding a banana to your daily routine might be one of the smartest choices you can make. So who really needs to be careful about how many bananas they eat? Bananas are great for lowering blood pressure because they're full of potassium. But here's the thing. Too much potassium can be a problem, especially if you're already on certain blood pressure medications. Now, eating bananas alone usually won't cause potassium overload. But if you're taking medications like ACE inhibitors, which are commonly used to treat high blood pressure, they can already raise the level of potassium in your blood as a side effect. So if your potassium is already on the high side because of your meds, eating more bananas could raise it even further. And what happens when potassium gets too high? It can mess with your heartbeat. You might feel heart palpitations, like your heart is fluttering, or skipping a beat. In severe cases, it could even become dangerous. Too much potassium can also drop your blood pressure too low, which isn't good either. This doesn't mean you can't enjoy bananas if you're on medication. Just keep an eye on your blood pressure and make sure you talk with your doctor. And one more thing. If you have kidney problems, your body might not be able to get rid of extra potassium the way it should. So if that's the case, be sure to talk to your doctor before adding bananas to your diet. And here's the takeaway. Bananas are packed with potassium, a mineral that can help lower your blood pressure naturally. Eating 2 bananas a day gives you about 900 milligrams of potassium, a great start toward the 4,700 milligrams you need each day. If you're not on any medication, it's a healthy and easy way to support your heart. But if you're already taking blood pressure meds or have kidney issues, talk to your doctor first, because too much potassium can lower your blood pressure too much. Overall, bananas are a heart-friendly fruit, and even plantains offer similar benefits. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.